Welcome back, dear friends and students. We were discussing chapter number 4, reproductive health. We have discussed few aspects of reproductive health in the previous sessions. We have discussed what is reproductive health, why it is necessary, what is the importance of a reproductive health, and we have also discussed the various types of contraceptive method, means a birth control method, that is the main aspects of reproductive health. Now we have to move ahead, and today we are going to discuss regarding the diseases of reproductive system or the sexually transmitted diseases. So today we have to learn STI. What is a STI? STI means, what is the full form of STI? STI means sexually transmitted infections. What is STI? Sexually transmitted infections. They are called as a STI. Okay. So what is the definition of a STI? So STI, that means the infections or diseases which are transmitted through a sexual intercourse or a coitus. This is called as sexually transmitted infections. Clear, student? What is the STI? The infections or the diseases which are transmitted through a sexual intercourse or a coitus, they are called as sexually transmitted infections. Okay, and this is again an important aspect of a reproductive health. Sexually transmitted infections can also be called as reproductive tract infection. Okay, which can also be called as RTI, reproductive tract infection. Okay. Next, it can also be called as, what's another name of this sexually transmitted infection? It's also called as vulnerable diseases. Okay. So they are also called as vulnerable diseases. So these are the three names of sexually transmitted infections, and that is the definition of what is a sexually transmitted infection. I again repeat, sexually transmitted infection or STI can also be called as reproductive tract infection, RTI, or it can also be called as vulnerable diseases. Now what is the definition of this sexually transmitted infection? The infections or the diseases which are spread through a sexual intercourse, they are called as sexually transmitted infections. The main sexually transmitted infections are, there are variety of the infections, they are going to be spread through it. Okay, so what are the usual infections that occurs? So these are the name of diseases which are sexually transmitted infection. Gonorrhea. Next, another one is syphilis. Okay, next is chlamydiasis. Next is called as genital herpes. Next is called as hepatitis B. Next is called as AIDS. Okay, next trichomoniasis. So these are few of the diseases or the infections which are sexually transmitted. So which are they? There are few examples. Gonorrhea, second syphilis, third chlamydiasis, fourth is genital herpes, next is hepatitis B, AIDS and trichomoniasis. Okay, so these are transmitted through sexual intercourse. These diseases are transmitted, or the infections are transmitted through a sexual intercourse. But from these two, hepatitis B, this is hepatitis B, and the AIDS can also be transmitted through a use of syringes and the needle of infected person, or the reuse of syringes, needles or the surgical instruments which comes in the contact with an infected person. Or these are the diseases which can also be transmitted through a blood transfusion. If the blood of an infected person is transfused to another person, this is not a sexual contact, But if the blood is transfused to another person, these two diseases can also be sprayed or transmitted. Even these are the two diseases, particularly the AIDS, can also be transmitted from infected mother to a fetus. Okay, so all these diseases can be transmitted sexually, but these two diseases can also transmitted by other ways apart from a sexual transmission. What I have mentioned, I again mentioned how they can also transmit apart from a sexual intercourse. So they also transmit by the use of syringes, needles and surgical instruments of infected persons. Second, it is also transmitted through a blood transfusion, okay, or transfer of a blood. And third, it can also be transmitted or transferred by from infected mother to a fetus. So this is how they are going to be transferred or transmitted. Now let us see what are the causative agents of these diseases or these infections. Which microorganism, which bacteria, fungi or viruses, they causes such kind of an infection. Okay, so let's discuss one by one diseases. Okay. So start. First disease. I just first list out the name so you can easily remember. You know that which are the sexually transmitted infection. First is gonorrhea. Second one is syphilis. Third one is chlamydiasis. Next is genital herpes. Okay. Next one is hepatitis B. Okay. Next one is AIDS. Okay. Next is trichomoniasis. So these are the few examples. Now we have to see what is a causative agent or by which microorganism this infection can occur. So let's start with gonorrhea. Gonorrhea that occurs due to or that is transmitted or that is caused by a bacteria called as Neisseria gonorrhea. This is the name of bacteria, Neisseria gonorrhea, by which it is transmitted. Remember, it is a bacteria. Okay, by which they are going to be transmitted. Okay, it's a bacteria, Neisseria gonorrhea. Now the syphilis. A syphilis that is caused by a bacteria, specifically a spirochete. What is the name of this spirochete? It's caused by Treponema pallidum. These all are the biological name. Okay, and this is also a bacteria. Treponema pallidum is also a bacteria by which the syphilis can occur. Next is chlamydiasis. The chlamydiasis is caused by chlamydia or Chlamydomonas trachomatis. Sorry, T small. It is again a bacteria. Okay, by which this disease is transmitted. Okay, clear? Again repeat, gonorrhea is caused by Neisseria gonorrhea, a type of bacteria. Syphilis, this is an infection caused by Treponema pallidum, a spirochete, a type of bacteria. Chlamydiasis, that is caused by Chlamydomonas trachomatis, a kind of a bacteria. Okay, so these three diseases are caused by bacteria. Now these two diseases, genital herpes and hepatitis. The genital herpes is caused by herpes simplex, and this herpes simplex is a virus. So the genital herpes is caused by a virus. Which virus? Herpes simplex virus. Next is hepatitis B. The hepatitis B is caused by hepatitis B virus. So this is also caused by virus. Okay, which virus? Hepatitis B virus that causes a hepatitis B. Okay, next, AIDS. I hope you know the full form of AIDS. It is acquired immunodeficiency syndrome. Okay, acquired immunodeficiency syndrome, in which the immune system gets deficient. Okay, and so that's why the body defense mechanism or body immunity is not capable to fight with other microbes. So that is caused by a virus. The name of a virus which is causing it is HIV. Full form is Human Immunodeficiency Virus. What is the full form of HIV? Human Immunodeficiency Virus. So it's a virus which causes AIDS. Okay, so these are the three diseases which is caused by viruses. Okay, first is genital herpes, second is hepatitis B, and third is AIDS. Okay, next is trichomoniasis. A trichomoniasis infection, and that is caused by Trichomonas vaginalis. This is a name of a bacteria by which it is, it is not bacteria, it is protozoa. Trichomonas vaginalis, it's a protozoa by which it is transmitted. Clear? So these are the different diseases, sexually transmitted infections. They are caused by a different microorganisms. So again repeat, gonorrhea, syphilis and chlamydiasis, they are caused by bacteria. Genital herpes, hepatitis B and the AIDS, they are caused by viruses. Trichomoniasis, that is caused by a protozoa. Now you have to remember the name because these names are usually asked in entrance examinations and they are asked in a MCQ. Okay, so you have to remember the name. So I can repeat how this occurs. Trichomoniasis, that is caused by Trichomonas vaginalis, a type of protozoa. AIDS, that's acquired immunodeficiency syndrome, that is caused by HIV virus. That means human immunodeficiency virus, a virus. Hepatitis B caused by hepatitis B virus. Genital herpes is caused by herpes simplex virus. Chlamydiasis, that's caused by Chlamydomonas trachomatis, a bacteria. Syphilis is caused by Treponema pallidum, a bacteria, and gonorrhea, that is caused by Neisseria gonorrhea. So these are the different causative organisms which causes the diseases. Now, if this infection occurs, usually the different diseases have different symptoms and the signs. Like you know that if you have a typhoid, so what you have, the one prominent symptom in a typhoid is a diarrhea, a loose motion that occurs. Or if some person has a malaria, so the prominent symptom, they have a high fever. Okay, or you can see the latest one, that is if you see a COVID-19 disease, the coronavirus disease, then the main symptom is fever along with there is a respiratory failure or cough. Okay, so these are the symptoms. So same like this, these diseases have also their own specific symptoms and the signs by which the doctor diagnoses that diseases. Okay, clear students? So they have a certain signs and the symptoms. But yes, you don't have to learn in detail which diseases has which symptom. But there are few common symptoms which occurs in any sexually transmitted infections. So what are the common symptoms? I just list down what are the common symptoms or the normal usual symptoms they can be seen in sexually transmitted infections. So the usual symptoms are, you can say that, itching. Okay. Next, it is also next symptom is pain. Okay. The next symptom is swelling. Okay. Next symptom is fluid discharge. So these are the usual symptoms which are found in this sexually transmitted infection. What are the itching, pain, swelling and the discharge of a fluid? But from which side? From genital organs, means male and female reproductive organs. This kind of a symptoms may appear on the male and female reproductive organs. Okay, so these are symptoms of usual symptoms or the general symptoms of sexually transmitted infection: itching, pain, swelling, fluid discharge from the genital organ. These are the usual symptoms. Okay, now how this is going to be diagnosed? What is the diagnosis? Okay, so if anyone has a doubt regarding this sexually transmitted infection, because many times what is happening, how it is going to be spread. Before I start this diagnosis, I tell what is going to happen. Normally what happens, the infected female, that means those females who are infected with a sexually transmitted infections, most of the females remains asymptomatic, means they don't have any kind of a symptoms, they don't feel. When they don't feel, they have you can say that they feel like that they have nothing, but actually there is an infection which have been prevailing or the microorganism already residing in their body. And so that's why in the initial stage of that sexually transmitted infection, it is difficult to detect. So many times the females, they remains asymptomatic. Okay. Second thing, there is a prevalence of a social stigma. There is a kind of a fear. When I go to a doctor, what the doctor will say is, or when I say some family members that I have some sexually transmitted infection, what they say is, what the neighbor says, or how they behave to me, etc., etc. There are lots of type of a social stigma prevail in the society. So most of the time, we are not going to a physician and we are not solving our doubt related to a sexual transmitted infection. And what it happens, that may leads to a detection of that diseases at a later stage. Actually, we have to detect these diseases or the infections at the early stage. When we are able to detect it at early stage, then its prevention and its cure is possible. Okay. But if it is detected at a later stage, or if you go to a doctor very late, where the disease has been progressed very much in your body, so at that time the chances are that the other complications might going to occur. Okay, so what are the complications might going to occur? So let's discuss what are the complications might going to occur. So here, if there is a late detection, then it may leads to a pelvic inflammatory diseases. Okay, it may produces a stillbirth. Stillbirth means a delivery of a dead baby, that is called as a stillbirth. Or you can say a person may have an ectopic pregnancy. Okay, then the person might have an infertility, means not capable of producing a child, or sometimes the patient might have a cancer of reproductive tract. So if you do not care about this sexually transmitted infection at the early stage, then in the late stage, the other complications also occurs along with the infections, and these are the other complications might going to occur: pelvic inflammatory diseases, stillbirth or delivery of a stillbirth, presence of ectopic pregnancy, the development of other embryo apart from a main embryo, infertility, they lose their capacity to reproduce, or the cancer of reproductive tract might develop, and that affect the health adversely. Okay, so we have to be very cautious. If any kind of a symptoms of itching, pain, swelling or fluid discharge occurs from the genital organ, you should solve your doubt by consulting a specific doctor. Okay, you should not be refrained to check up your health with a medical expert or a doctor. Okay, you should always go to a medical doctor regarding to it. Okay, so these are the complications occur if the detection of a disease occurs at a late stage. There are certain diagnostic procedures how the doctor will do. Doctor will take out the symptoms, and apart from the symptoms, they will do a certain test, diagnostic test. When you are going to a doctor, they offer us some test. Okay, like blood test, urine test. Similarly, for sexually transmitted infection, there are also certain diagnostic tests. And which are the diagnostic tests? The diagnostic tests are culture test, in which a culture has been taken and specific microorganism has been identified. The second one, which is used for detection of AIDS, is a ELISA, enzyme linked immunoabsorbent assay. ELISA. Okay. Next is DNA hybridization. This is the another diagnostic technique. Next is PCR, polymerase chain reaction. So these are the few diagnostic techniques by which, or the diagnostic tests by which the doctor determines the patient suffers from which sexually transmitted infections. So which are the diagnostic tests? A culture test. Second is ELISA, enzyme linked immunoabsorbent assay. PCR, polymerase chain reaction, and the DNA hybridization method. You just remember the name. The detail regarding this test will be taught to you in another chapter or in another session. Okay, you just remember. So these are the few tests for a detection of a sexually transmitted infection. Okay, so diseases, their causative agents, what are the signs, symptoms. Early detection is necessary, otherwise it causes the complication. Such kind of a complication occurs if a disease is detected at a late stage. Okay, so if you have any doubt regarding the symptoms, you should consult a doctor as soon as possible and stay away from the social stigma. What the other will says, what the family says, stay away from it. And these are the diagnostic tests by which a doctor can specifically determine which sexually transmitted disease a patient has. Okay. But there is a one good saying that prevention is better than cure. Okay. So we should have to do a certain steps. So this sexually transmitted infection can be prevented. Okay. It does not happen to anyone. So what are the steps that has to be kept in our mind? So that's why this sexually transmitted infection does not transmit or spread. So there are certain steps has to be kept in our mind. So preventive measures, because a prevention is a good approach than the cure. Prevention is better than cure. Okay, so that's why we try to prevent this, so the disease does not cause, okay, to anyone. First is avoid sex with unknown partner or multiple partner. This is the first strategy need to be evaluated. Avoid a sexual intercourse with unknown partner or multiple partner. Second is use or try to use physical barrier methods like condoms during coitus or sexual activity. Okay, there should be a use of this, because you know that there is an advantage of this contraceptive method. It prevents a spread of sexually transmitted infection. Third, in case of any doubt, consult medical or expert medical practitioner immediately. Do not wait. Consult the medical or expert medical professional immediately. Okay. The doctor will say whether the person has a disease or not. That the doctor will say. It's a duty of doctor. Okay, you don't have to worry, but you don't have to wait, because if you wait, then the chances of complication are very high and the chances of cure is also less. If you are late, the chances of cure is also less. Okay, so these are the preventive measures. Avoid sex with unknown partner or multiple partner. Second, try to use the condoms during the coitus or sexual intercourse. Third, in case of any doubt, consult medical practitioners only or the expert medical professional and act according to advice provided by them. These sexually transmitted infections usually occurs in a younger age. The chances is very high. The data says that the chances of occurrence of this disease is highest in this age group. Okay, the person who are in the age group 15 to 24 years, the maximum number of sexually transmitted infective diseases are reported in this age group of 15 to 24 years. And then the age group which is affected is 25 to 29 years. This is the second most which is going to be affected. Okay, you are lying in this age group 15 to 24 years. So in this age group, these people have a highest chances of occurrence of sexually transmitted infection due to lack of awareness. Okay, so you have to be very aware, and in any case, any doubt, you have to consult a specific physician. Okay, so that's all about sexually transmitted infections. Okay, so I hope so all of you have done it, okay, very properly. So till then, keep learning, keep watching, like and subscribe this channel. Okay, thank you for subscribing. Okay, thank you once again.